Hey everybody, talking a little bit more about surgical treatment options for hammer claw or mallet toes. What I do a lot of in clinic are percutaneous or keyhole tenotomies, which are tendon releases. These are typically done for patients that have got flexible or semi-rigid hammer toe deformities, and what we're doing in that case is through a tiny little incision on the bottom of the toe using a 2mm blade or a very small needle like an 18 gauge needle, and we're releasing that flexor digitorum longus and the flexor digitorum brevis tendons, and potentially a little bit of the underlying capsules of the distal and proximal interphalangeal joint, depending on where their deformity is coming from. Now, when we undertake these procedures in those flexible toes, they straight away come into their corrected position. So before that patient even gets off the table, I'm already high-fiving and saying, yep, we've got a really good outcome here, and I'm really happy that they're going to go on to a positive outcome in the longer term. Now, when there's a little bit more arthritis or there's potentially a longer toe associated, we can do some of our minimally invasive surgery osteotomies, or ostectomies I should say. And this is where we're removing just a little bit of bone. Some of these I'm doing in rooms with just a small rasp, removing any osteophytes that may be causing corns, and that's typically what I'm seeing a lot of. And this procedure can be used in conjunction with those percutaneous tenotomies. So not only straighten that toe out, but to also remove any of those osteophytes or bone spurs that are occurring around the toes, from a functional point of view, as well as making sure that there's not going to be any reoccurrence in the future. And people get really good outcomes from this. Now, when we look towards a minimally invasive arthroplasty, these are where we're going to start removing maybe the head of the proximal phalanx, and then that's going to reduce any of that extra swelling from the bone around that area. It's going to be shortening the toe and therefore correcting the deformity, and really putting our patients in a good position to start undertaking their activity in a pain-free way. Patients that are typically having this type of procedure undertaken are those that have got rigid deformity through their proximal interphalangeal joint, and they typically, get back on their feet really quickly. Now, when it is a little bit more advanced, we do an open procedure for this, where we might be needing to do some soft tissue lengthening and some other concerns or other reasons there. But to be honest, I'm doing a lot more keyhole or minimally invasive procedures for these type of toes than what we're looking at with our open procedures. For those that are really not having a positive outcome longer term, or it's very rigid deformity, particularly through that second toe, that's where I might look at an arthrodesis or fusion procedure of that proximal interphalangeal joint. That's going to put that toe into a straight position and make sure that it's not going to be causing any claw or hammer toes in the future. Now, when these toes become, quite, if I do that arthrodesis and it's sitting up a little bit in the air, or I'm finding that all the tissues are still quite tight, that's where I may undertake a wild metatarsal osteotomy. And that's a procedure that basically shortens the metatarsal and allows that toe to sit down a little bit closer to the ground, allowing some purchase to be undertaken. It's a great procedure and pretty quick recovery there. There may be a screw in this one, and similar for the arthrodesis, there may be a wire or an implant that we put in there. But typically these patients are back on their feet really quickly and going for gold from there. So hopefully this has given you a little bit more information about surgical treatments for hammer claw or mallet toes. There'll be more information coming up, but at the moment, please hit the subscribe button, have a look at some of our other videos, and we'll see you on the next session. Cheers.